So, welcome back. So, we are going to talk about the complications of the persistent high blood pressure. Well, in the brain, you can have the cerebrovascular accidents, which are also called as strokes. You can have hypertensive encephalopathy, which can lead to confusion, headache, convulsions. Then in the eyes, you can have hypertensive retinopathy. You can have detachment of the retina. In the heart, you can have myocardial infarctions. You can have dilated cardiomyopathy and heart failures. Well, there can be elevated levels of sugar. Well, in the kidneys, you can have chronic and acute chronic renal failures. You can have hypertensive nephropathy. So all the end organs are or can be damaged due to persistent high blood pressures. Now, what is coronary artery disease? Well, this is a disease which affects your coronary arteries. It can lead to the narrowing of the arteries due to deposition of fatty plaques, a fatty material like LDLs, which can lead to the formation of atheromas. And when the narrowing over the period of time increases, it can lead to symptoms of pain in the chest, which is called angina. And when the occlusion is complete due to a rupture of a atheromatous plaque, then it can lead to thrombosis, and which can culminate in a myocardial infarction or heart attack. There are two coronary arteries. One is the right coronary artery and the next one is the left coronary arteries. The left one supplies the left side of the heart, further divided into left anterior descending and left circumflex. The right one is divided into right marginal branch and posterior interventricular branch. Well, RCA, LAD and LCX are the culprits where the narrowing occurs, and patient, due to the blockage of these major vessels, lands up in the ICU with myocardial infarction or unstable angina, which is called as acute coronary syndrome. Now I am showing you a picture where you can see very well the deposition of the fatty material and subsequent narrowing, which will lead to, now here you are seeing the narrowing of the artery with the atheromatous plaque, whereas in this vessel you are seeing not only narrowing but also thrombosis due to rupture of a plaque. Now, coronary artery disease generally refers to the buildup of cholesterol inside the layer of the artery. The plaque weakens a wall, as shown in the lower artery. A crack may develop in the plaque and blood clot may form. This is a mechanism of most heart attacks. Coronary artery disease is blockage of vessels which supply the heart with blood. This disease process is called as arteriosclerosis or hardening, stroke or stiffening of the arteries. In this process, cholesterol and other fats are deposited in the layers of the arteries and narrowing the channel for the blood to flow. What is ischemia and ischemic heart disease? Ischemia is imbalance between the demand and supply of oxygen to any body part or organ. When it relates to heart, that is imbalance between the supply and demand of oxygen to heart, then the disease is called as ischemic heart disease. So the myocardium is not receiving enough blood, so it is ischemic. There might be an increased myocardial oxygen demand during exercise, during emotional stress, exposure to cold weather, ingestion of a large meal, which increases the demand for the blood by the gastrointestinal tract. So now we come to a symptom called as angina, and angina pectoris is the term given to it. This is a recurring pain or discomfort in the chest. This usually occurs when some part of the heart does not receive enough blood. It's of two types. First is the stable angina. Angina pectoris often occurs in a regular or a characteristic pattern. Commonly, a person recognizes that he or she is having angina only after several episodes have occurred, and a pattern has evolved. The level of activity or stress that provokes the angina is somewhat predictable, and the pattern changes only slowly. So a person is subconsciously aware when he will have these symptoms once again, or he is aware of the pattern of the disease. This is called as the stable angina. Then there is a term called as the unstable angina. Instead of appearing gradually, angina may appear as a very severe episode, usually with unpredictability. Angina in these forms is referred to as unstable angina and needs prompt medical attention. It is a part of their acute coronary syndrome. Now the next disease which we are going to talk about is myocardial infarction. Well, myocardial infarction is a manifestation of ischemic heart disease. It may occur due to sudden coronary thrombosis or a plaque in the coronary blood vessels. It causes cellular death of the myocardial area. Infarcts are sometimes silent, which means without pain. The pain relief is due to destruction of the subendocardial nerve fibers. These silent infarcts are commonly seen in diabetics. Now the next term or the next disease which we are going to discuss is chronic heart failure or congestive heart failure or congestive cardiac failure. All these are synonyms. Well, when the pumping power of the heart becomes weak, blood moves through the heart and the body at a very slow rate. So what happens is the pressures in the heart start increasing. Heart cannot pump enough oxygen and nutrients to meet the body needs. So the heart needs to expand, it needs to stretch in order to hold more blood. Over the period of time, the recoil action, that is stretching and coming back to its origin, is lost. So the cardiomyocytes, they become stiff and thick. They can't anymore stretch. So this helps to keep the blood moving for the time being. But as the heart weakens, it becomes unable to pump the blood as efficiently as it used to. So this results in retention of fluid and salts due to dysfunctions of the kidney. The body becomes congested. The body becomes edematous. So it is filled with fluid. And this term, generalized edema, is called as anasarca. I'll show you a picture where you can see for yourself what is anasarca and what is generalized edema. So what is the definition of congestive heart failure? Let me tell you once again. Congestive heart failure is a broad term used to describe a condition resulting from the inability of the heart to adequately pump blood and causing symptoms such as orthopnea, dyspnea on exertion, and edema. So you can see the picture where there is puffiness all over the body. The legs are swollen, the ankles are swollen, the foot is swollen, the thigh, the calf, the hand, the face. Even when he is coughing, he has got some fluid in it. The lungs are full of water, or the medical term is pleural effusion, excess of fluid across the lungs. Then you have swelling in the abdomen, that is called as ascites. So all these are signs and symptoms which are related to congestive heart failure. So the patient is aware of his own heartbeat, and the term used is palpitations. There is a potential of stroke and embolism. Now the next disease which we are going to discuss is dysarrhythmia. Cardiac dysarrhythmia, also known as arrhythmia or irregular heartbeat, is a group of conditions in which the electrical activity of the heart is irregular or is faster or slower than the normal. The heartbeat may be too fast, that is more than 100 beats per minute, or too slow, that is less than 60 beats per minute. It may be regular or irregular. A heartbeat that is too fast is called as tachycardia, and a heartbeat that is too slow is called as bradycardia. Arrhythmias can occur in the atrium or in the ventricles. Arrhythmias may occur at any age and even lead to sudden cardiac deaths. What is sinus arrhythmia? Well, this refers to the normal phenomenon of mild acceleration or deceleration or slowing of the heart rate that occurs with breathing in and out. It is commonly seen in children while meditating and while doing those breathing exercises. There is a term called as proarrhythmia too. This is a new or a more frequent occurrence of pre-existing arrhythmias, paradoxically precipitated by antiarrhythmic therapy, which means when you are taking an antiarrhythmic therapy, you get new arrhythmias. This is a side effect associated with the administration of some antiarrhythmic drugs, as well as drugs which are used for other indications. So there is another term which is called as fibrillation and flutter. Well, in fibrillation, again the heart rate is high. It's more than 100, which is for tachycardia. Even in flutter, the heart rate is high. It's more than 300 for flutter beats per minute, whereas here it is somewhere around 250. So characteristic is sawtooth pattern in the ECG. Sawtooth, you can see it here. This is the sawtooth appearance. Whereas in fibrillation, the P wave is missing. Ideally, the P wave has to be here and it is missing. Instead of it, you have fine wavy waves here, here, here. So this is fibrillation, and the one down is the flutter. There is a term called as a paroxysmal supraventricular tachycardia. It is a rapid heart rhythm originating at or above the atrioventricular node, that is the AVN. Then there is a term called as ventricular tachycardias. This is rapid rhythms that originate within the ventricular tissues and are very dangerous. So these are some abnormal rhythms which are commonly found in patients.